All right, so we're back, and Seth Weil aboard is with us via Zoom. So we're going to bring him in one time because we're 4 minutes away from the hour of the clock. Seth, what's up, man? Good morning.
Good morning, Stefan. We Synergy TV.
Hey.
All of our viewers.
New background, boy.
Locally, internationally, regionally. Yes, I decided to make a little change to the background.
All right, nice, man. Looking sexy, man. Go ahead, man.
Excellent. All right, so let's get into it. So let me ask the viewers a question, a serious question. When people say they want healing, do they really want healing or do they really want relief? Because those are not the same thing, right? You know, relief is temporary, healing goes a lot deeper, right? Relief suppresses symptoms, healing addresses what is causing the body to break down. And that is why so many people today keep going in circles with their health, because they have been trained to chase relief, not healing. And I want to explain that through one anonymous story here. The story involves two sisters.
Right.
And this story, it could not have been more powerful, unless they were twins, of course, but they aren't, right? So here you have two sisters, same family, same bloodline, same broad disease category of cancer, breast cancer. Two different paths, two different outcomes. One of the sisters was diagnosed with stage 3 breast cancer. At that point, surgery was being recommended. But before going through with it, she came to me and entered my nutritional therapy program. Now, my program is not casual. It is structured, it is disciplined, it requires people to follow instructions, it requires people to fill out the daily questionnaire feedback form. It requires people to track what is happening in their bodies. It requires people to follow clear guidelines on what they can and cannot eat. In other words, it requires commitment for those that have been on my program. And that is why some people find my program to be difficult, because they have been conditioned to want convenience, not correction. But this sister followed my program, my nutritional therapy program. Then she went back to the hospital for the surgery, because some people, like I said, might find it a bit difficult, so she decided, let's go back for the surgery, expecting the surgery to be done. And this is the part I need people to really, really hear. Before the surgery could even be done, the doctors found, to their surprise, that there was no cancer there. Gone. Right? Now let that sink in for a little bit.
Mm-hmm.
She went back for surgery, and before the surgery could even take place, the doctors found no cancer. Now, no drugs, no chemo, no radiation, no surgery, only nutritional therapy. And that is why this story matters so much. Because the story doesn't end there, because there were two sisters. The other sister also faced same cancer, right? But she followed the conventional route, which was chemo, radiation, surgery. And now after all of that, she's dealing with major health issues, including rapid weight loss. And that's what led her, through the referral by her sister, to contact me. All right? Now think about that contrast. Think about the contrast. We have two sisters, we have two paths, we have two outcomes. One followed the conventional system, one followed nutritional therapy. One went through chemo, radiation, and surgery, and is still struggling. The other followed nutritional therapy program, went back for surgery, and before the surgery could even happen, the doctors found no cancer. Again, no drugs, no chemo, no radiation, no surgery, just nutritional therapy.
Right.
That is not a small point. That is the point. Because what this shows is that there is a major difference between targeting a disease label and restoring the body systematically. That is what people keep missing. If the body is still weak, still deficient, still stressed, still overloaded, still breaking down internally, then simply removing something does not mean the body truly been restored. So just going to do a surgery and taking out something that is not going to restore the body.
Right.
And that is why my approach is systemic. And yes, it requires effort, People have to follow instructions. People have to be consistent. People have to observe their body. People have to report honestly. People have to follow the guidelines, right? People have to participate in their own recovery. As I mentioned before, this is the most interactive approach to healthcare. And many people struggle with that because we have been spoiled by a culture of quick fixes. But let me ask you something. If poor health was built through years of repeated damage, repeated deficiencies, repeated stress, repeated wrong input, why would true recovery not also require corrective and repeated corrective intervention? Right?
Okay.
If it took a process to harm the body, why would it not take a process to
repair
help
it?
heal the body?
Okay.
Exactly. Right? And that is what many people do not understand. True healing is a process. You don't get it from a product. It requires effort, it requires structure, it requires consistency, it requires repeated corrective action. And that is exactly why my program is designed the way it is. But over the years of doing what I do, I have seen situations, similar situations more than once. In fact, many have even contacted you in the earlies, and you have read it live on television as well, all right? People have come to my program, then they come off of my program thinking it wasn't working, only to later go and do a test, Stefan,
Right.
and find that the condition gone. And I've seen that happen with serious issues, including cancer-related cases, autoimmune conditions, diabetes, right? I've seen it with PCOS, endometriosis, adenomyosis. I've had people who go on and did blood work after coming off my program, saying it not working, then come back and tell me that when the results from the blood work came in, it was the best blood work they had in decades. In decades, you know. So this is just not about this one story. Right? This is part of a pattern that I have seen over the years.
Right.
And that is why I keep telling people that true healing requires a systemic approach. It requires commitment, it requires structure, it requires consistency. Because true healing is not about silencing symptoms. It's about changing the internal condition of the body. That is what nutritional therapy does. It works on the body's condition. It does not just chase the symptoms. It supports restoration. It supports repair. It helps correct what has been breaking the body down. So when I tell people that the body can do far more than they have been taught to believe, I'm not speaking loosely. I'm speaking from what I have seen. And that is why my work matters, because nutritional therapy is not something people are being properly exposed to in this country. In fact, I'm the only person in this country doing nutritional therapy. And I did not come to this approach by accident. I came to it because I saw what was missing in the conventional system. I saw a way of thinking that focused on symptom suppression, disease management, and temporary control, while overlooking the deeper nutritional and systemic breakdown of the body. That missing piece was nutritional therapy. And that is why my work matters. And people need to know that there's another way to think about health, not just symptom suppression, not just management, not just temporary relief, but true healing through a systemic approach. So if people out here, if you all are listening, right, and you all are dealing with a serious health issue, or you feel as though you are only managing symptoms without truly getting to the root of what is going on, then you have to ask yourself this question: have I really been trying to heal, or have I been trying to suppress? Because those are not the same thing. If you want to understand the deeper reasons why the body breaks down and why so many people are sick without understanding the true cause, this is why I wrote my book, You Are Not Sick, You Are Malnourished. Right?
If you want to understand what's really happening inside your body, I break it down in detail in my book, You Are Not Sick, You Are Malnourished. It's available on Amazon and Gumroad, RIK bookstores nationwide, Nelson's bookstore in Tobago, or directly through the clinic.
Right.
Now, I know it have people that are skeptical. A lot of people are skeptical, right? And skepticism is something I welcome. But let me mention this. Skepticism without investigation is reckless, right? Is reckless. You could be shortchanging your own self. Skepticism without investigation is reckless. This is why I wrote my book, You Are Not Sick, You Are Malnourished. It's available all RIK bookstores nationwide, Nelson's bookstore in Tobago. It's on Amazon, and the digital copy is on Gumroad.
Right.
Get the book, investigate, see what nutritional therapy is all about, and then take that step. And if people want proper assessment of their condition so that we can, identify what is actually going wrong with them, and they want changes to be made to help the body truly heal, then book a consultation. Book a consultation. Nutritional therapy is not an option. People think it is. It's not an option because the body cannot exist without proper nutrition. Right? It is the foundation of true healing. So I have my website at WIOS.com, or people could call 279-3935, 761-1952. You could call those two numbers. And like I mentioned, have been mentioning, it is better to have the knowledge and not need it than to need it and not have it.
And not have it.
All right?
Yeah.
This is not an isolated situation, but this was an ideal situation for me to mention it publicly because it's two sisters. It's two sisters. So you couldn't get it better than that unless it was twins, like I mentioned earlier. And they both had the same issues, but one took the conventional approach and one took the nutritional therapy approach. One person, cancer vanished, no trace. Right? The next one went through all the treatment options, the surgery, the chemo, the radiation, and still have health issues today that they now have to come to me.
But
right?
the new
People. Yeah, go ahead.
So the sister is coming to you now.
Yeah.
Right.
Right.
But then we're going to get so we're going to get an update. We will get an update on the sister in time to come.
Yeah. Keep in mind, these things did not take a short span of time, eh? Right, because healing, like I said, is a process.
Yes.
So it took a span of time, right? And this is also what I mentioned earlier. It took a long time to damage the body, right? So it's going to take some time. It's going to take a process to heal. But people, we like quick fixes. We only want, quick fixes are only symptom suppression. So people want to come by set today and tomorrow. The condition must be gone. No, you have to be committed to the process. Committed to the process. I had people come to me after 3 months. I had a woman some years back, right, diabetic. Say, well, after 3 months, I still diabetic. So my assistant called her in the 4th month, right? She had come off my program. And she said, well, her diabetes is gone. She said, but it's I who get rid of it because I just stopped taking the medication. Right, Stefan? Right? That woman was saying it's simply because she stopped taking the medication. That's why her diabetes is gone. Had nothing to do with the 3 months on my program where the diet changed, right? Had nothing to do with that. It just happened to go because she stopped taking. If diabetes could have gone just for simply stop taking medication, everybody would have been diabetic free, correct?
Yeah, correct. Correct.
Right? So some people are just a little bit too hasty. You have to be patient with healing. Patience. Patience plays a key role. You have to be committed to the process, right? The body has to correct things from hormonal imbalances to immune dysfunction, all right? It has to regulate all those things to build back up deficiencies. It has to fix back a lot of things that have been damaged over the years and decades.
Yeah.
Don't rush the healing process. My program, what I do, I coach you for you to reach a point where you no longer need my assistance. You can now handle your diet on your own.
On your own, yeah.
And once you continue that way, the body continues to heal. Continues to heal, right? But like I said, skepticism is welcome, but skepticism should always come with investigation. Don't be skeptical. Because I've heard people bash me, Stefan, and they didn't have the slightest clue of what my business is about.
Yeah.
All they just hear is,
join the club.
Guy is the front.
Join the club.
Right? That's why we're on the same program.
Join the club. I don't want to tell you, join the club, brother man. Join the club. Welcome to the club.
Yeah, they bash me and ask them what Setwile Holistic Health Clinic is about. They don't have the slightest clue. They don't have the slightest clue. They just hear, now you're doing something different from the conventional method, so therefore it's wrong. right? Therefore, it's wrong.
Well, yeah.
But guess what? I've gotten more reversals than the healthcare system ever could. Ever could, because most of the things in the healthcare system, they tell you it's chronic, you have to live the rest of your life with it. And those are things that I have been reversing, right?
Yeah.
So people, you all just investigate, do some investigation. And I wrote my book so that people can investigate. You go in and see
Yeah.
what my program
The book is an
about.
excellent read, I must say. Excellent read.
Yeah, thanks.
Yeah,
Right?
excellent,
I put a lot
excellent
of effort into it. I put a lot
Yeah.
of effort
And it's
into
not a big, thick book.
it. Exactly.
It's so simple.
You see, a lot,
It's like a West Indian reader. Something
correct.
like that.
And I call it information dense. I didn't
Yeah.
want to have too much of fluff in the book, which is unnecessary things that people would make to make up pages. No. I keep it information dense. I also take into consideration of people's attention span. Right? So I keep it information dense, get straight to the point. In fact, that's some of the views that people have gotten. They like how I went straight to the point.
Straight to the point, yeah.
Straight to the point.
No beating around the
Right?
bush, no, yeah. Saves you a lot of time because people I sit down and I read a thick book, so
Yeah.
you know what I mean. But the book it's a quick read. You could read a book. I would imagine if you really take your time, you could read a book in a day. The whole book.
Correct.
You understand what I'm saying?
Correct.
Um,
Right?
If you have the time, you just go through and you just read. And in a day you finish. You know what I
Yeah,
mean?
so I've had people read it, and then they said because of how much good information it have, they read it over a second and a third time.
No, well, yeah,
they
because
want
I
the
think
information to stick.
I think yeah, it's important to read when you have content like that. You got to do it over and over and over, so
Over
that
and
yeah,
over,
it
yeah.
kind of stick in your head now. You know, because if you read it once and you put it down,
Read it. Yeah.
you tend to forget. You know, but the
You
more you
can forget some
familiarize
stuff,
yourself
yeah.
with the information, is better for you. So yeah, it's a terrific read, and folks, you could get the book. You could call Set 76119522793935. Those are the numbers you could call, whether you're out regionally, internationally, wherever you are around the world. You could connect with him. It's on Amazon. It's in RIK bookstores nationwide and in Nelson's.
Nelson's Bookstore,
Nelson,
Tobago.
yeah, Nelson's and Tobago.
And then there is the digital copy on Gum Road.
Okay.
Yeah.
So you can get digital copy now. So make sure, check it out. You are not sick, you are malnourished. I think it's very important. There's a reason why, look, all trainers will tell you, and doctors will even tell you, like even with your gut, like with me with my gut, right? Even the conventional medical fraternity will tell you that this is more diet than exercise. They said it's 70 to 80% diet in terms of what you eat, your nutrition, than exercise, right? Exercise is more for toning and stamina and things like that.
Like I tell people, exercise is a measure of performance.
Yeah,
Nutrition is what deals with health.
right.
Exercise measures speed, agility, strength, right? But health comes from what you eat, right?
Correct.
That comes from what you
And that's basically the long and short of it. So, when you're talking about nutritional therapy, no supplements, no this, no that. Before it had supplements, women, what do you use?
Yeah. And some people are shocked when they see me in the gym and say, I use nothing, I use absolutely nothing. I don't use no creatine. I don't use any protein powders. I use absolutely nothing.
Yeah.
Absolutely nothing. All right? And hopefully we do an in-studio session so people could actually see me, because you have some people think I'm overweight and stuff like that. So,
Whenever you're ready, you come up here.
yeah, hopefully I'll come in Tuesday up the road so people could actually see me physically.
Yeah.
Right?
When you're ready, you come up here. Don't frighten.
Yeah.
I know you're coming from the South Land, but nevertheless.
Yeah. All right? But I don't mind making the trip up once in a while.
All right, nice
it's
man.
it's what, 5 years now? 5 years.
Yeah, it's a while. Been doing this. And I hope people take the information, man. Valuable.
Yes.
So, Seth, thanks a lot, man.
All right, thanks for having me. See you next week.
All right. So that is Seth Weil aboard on the inside. A very interesting story with those two sisters. And I'm telling you, that's not the first time. I remember the lupus patient as well, who was actually, I think, the president of the Lupus Association in time. And She was on this program. She went to get tested on the lupus. They couldn't find her lupus. And she gave a testimonial on that. And it had some backlash with that, but, you know. I want to go into that.
If you want to understand what's really happening inside your body, I break it down in detail in my book, You Are Not Sick, You Are Malnourished. It's available on Amazon and Gumroad, RIK bookstores nationwide, Nelson's bookstore in Tobago, or directly through the clinic.